Okay, so hi everyone. We are here with another Pink Table Talk. I'm very excited today to have two amazing young Black women here with me to talk about our sex therapy edition of Pink Table Talk, which is very, very exciting. So first, we'll do a couple introductions, and then I will we'll jump into what we're going to talk about today. So, Dr. Angel, why don't you go ahead and take it
Wonderful.
away?
Well, hello. Well, first of all, thank you so much for inviting me. I love having these candid talks, especially about sex and Black and brown women actually enjoying sex and like having these free conversations. We don't get to have them often. So thank you so much for inviting me on here. I'm really excited. Like you said, my name is Dr. Angel. I am a clinical social worker. I have been for the past 20 years. I have my master's in social work and my doctorate in social work as well. And my specialty is trauma and sex. So that's me.
Yes. And Jada, who are you?
Yes, I am Jada Blair, and I'm a part of the Young Women's Advisory Board of Touch, and I am a breast health advocate to the younger demographics and love to help spread awareness about breast health and taking initiative of your health overall.
I love it. I did not introduce myself. I am Haley Brown Buxton Punch. I serve as the VP of Programs and Partnerships at Touch the Black Breast Cancer Alliance. And here comes my co-host, Dr. Candace. Um, so Dr. Candace, we literally just started some introductions. We were recording, but thank you for being able to join us today. I know that you are in the midst of being an amazing doctor, so it's a lot going on, but we're happy to have you. Um, but if you want to unmute and introduce yourself, that could be great.
Hello, everyone. Sorry, I'm happy to be here. I just finished clinic and got my days mixed up. So,
No worries whatsoever. We really want you to be saving all the lives that you're saving, so that is okay. But for Pink Table Talk, it's also really important to ground us in what we do for what our campaign is, and all of that. So, for Love of My Girls campaign started now like 3 years ago, which is crazy. Um, and it's all about Black breast health, right? If Black breast cancer is real, then so is Black breast health. And Black women under 35 are dying at two times the rate. I'm sorry, getting breast cancer at two times the rate and dying at three times the rate of white women. So it's really, really important to bring this piece of education to this younger demographic, as Jada said. And we're happy to be able to bring in some fun topics like sex therapy, which is exciting. But in this campaign, we really want young Black women to, one, dive into their Black breast health, know that it's real. Two, unlock their her story, talk about your shared health family history. Um, and then three, get to know your girls, right? It should be part of your self-care. Get to know them monthly and build it into your routine. And so, Dr. Angel, so last week or about a week and a half ago, my mom and I were in Ghana, so we're obviously sharing a room. And so I'm hearing you speak on the talk with her on The Doctor Is In. So I was like, oh my God, we gotta have you on the show. Um, I can't wait to get to hear your perspective on what we talk about here, which is basically the same thing, but slightly a demographic not yet affected by breast cancer, right? And so what information you have to share with us, which I'm really excited about. But when I just said family her story, I heard you the other day talking about like knowing your parents' sexual history and like that being a part of the equation in some interesting way, right? And like that kind of maybe guiding some of yours. So, anyways, would love to like hear more about what you do, who you are, skin folk therapy, everything that you are. So go for
Yeah, absolutely. Thank you. And can I just say I love your mom? We met at another breast cancer event and they put us next to each other. And it was like the best and worst thing ever because we couldn't stop talking. I was like, oh my God, I love this. Like, so for her to invite me on, it was just such a full circle moment. So I really do appreciate that. So my private practice is called This Is For Us By Us. This is us. I wanted people to know that there are Black and brown therapists in their culture, in their community that are here for them to talk to. A lot of times, we're like, you need Jesus, not therapy. No, you can have Jesus and therapy. They actually go hand in hand. Like, he would love for you to come talk to us. It is not a problem. So just trying to break that stigma of saying like therapy is okay. And I think the best way to do it is to let them know that there are therapists out there that look like them.
Yeah.
So when I came up with my private practice of skin folk, I really wanted to scream it. I wanted to say, I am here for us. Like, you have no excuse saying I can't find a Black therapist. It is called skin folk therapy. You already know what this is. Um, because what I was learning was I was a trauma therapist for 15 years. I worked with foster care. And the trauma there was just, you can only imagine. But I learned that a lot of the trauma was also sexual trauma. And I
Mm.
learned that those girls, those young women, even the boys, they weren't able to take that back and enjoy sex. It became like this horrible thing that happened to them. And then it was like, okay, well, this is my view of sex forever. Like, I don't care. It is something that someone took from me. I don't have control over it. So being able to work with them, and I was like, well, you guys gotta be able to enjoy this again. Like, this isn't something that you should see as a chore, as something that you must do for your partner. Like, this is still something that you are able to enjoy and take back. So I started to combine the two, the sex therapy and the trauma. So we do a lot of trauma work with people. And then I get them to the other side where sex is no longer this horrible chore or something that they have to do. Also, my practice, if you guys probably haven't heard, like it's 95% African American, but it's also women between the age of like 35 and 55. And this is a generation that wasn't able to talk to their aunties and grandmas and moms about sex, about pleasure, about any of that. So they're either in like sexless marriages or relationships, or they're just not happy. And they're like, how do I do something about this? They're like, okay, I kind of want to take this back. I want to enjoy this. So the other part of my practice is really teaching women how to enjoy it and how to talk about it and be safe about it. We do, the monthly breast test. They have to take mirrors and go into the bathroom and look at their vagina, and they have to be able to label it. They have to know what it feels like, what it smells like. So when everything is normal, you know exactly what that's supposed to be. So when something goes wrong, you can say, hold up, wait a minute. This isn't how I usually feel, how I usually smell, how the sensation is different. So just teaching that and seeing women just come around to another side, like, we're allowed to do this? Like, oh my gosh. So that's where my practice is right now.
Thank you for sharing that. I have a few questions, I guess, for our listeners as far as like if they're really interested in Skinfolk, how do they sign up? Is it covered for everyone? Like any insurance things that they should know about and as well as location, any state, or is it a specific area?
Absolutely. So you can find me at skinfolktherapy.com. And Skinfolk Therapy, that is the Facebook, the Instagram, the TikTok, the everything. It's Skinfolk Therapy, but the website is skinfolktherapy.com that they can reach me at. Right now it's all telehealth. After COVID, I just decided to keep going that way. I do in-person events, but for therapy, it is all telehealth. Right now, I am licensed in Maryland, DC, Virginia, Georgia, and Florida. So anybody in those states, definitely. Insurance wise, some insurance, some not insurance. You're just gonna have to reach out and see. I can say that right now I do have an extremely I don't want to say long, but a nice wait list at the moment. But I have an amazing circle of sex therapists that I am able to refer out to. So if something doesn't match my schedule, then I can absolutely send them to somebody else who I feel has the same vibe and the same flavor that I'm working with. So absolutely, please reach out.
No, that's so great because I mean, like, I probably asked my therapist, not like details about sex therapy, but I'm talking about my sex life and therapy, like I'm talking about those details and like the things that come up for sure um because I think I'm reflecting right now on like you said like that age range like 35 to 55 having not talked to their parents and like I mean like I remember the first time I told my parents that I had sex and I remember not getting the best response,
Mhm.
and that kind of shaping how I talk to them later about it. Like it took me a nice period of time to talk to them again about even relationships because of that initial conversation, you know? Jay, I don't even know if you remember those days, but it was not cute. Jay probably remembers those days.
I do remember you guys having a lot of fun at your house and yeah, just me having my own fun too,
Yeah,
with
but
your
I mean,
mom and the dogs and stuff.
well, I think even and my parents would consider themselves like open and like, but like
Yeah.
even with them being as open as they are, was I able to talk to them about this? You know what I
Right.
mean? That kind of changed that. So I'm wondering, like, when did when is it good to start like noticing your sexual self? You know what I mean? Because right now we're talking to like young Black women. When is that appropriate? Who defines when that's appropriate, right? Because that's, I think, what came up
Mhm.
in my life.
And I think that's the thing. And I think that if you start with parents, we have to start listening to our children. We have to know when consequences are appropriate when they tell us stuff. Because if every single time you hit your parents with a, I broke the vase, I wrecked the car, and it's this huge punishment or whatever, they're never going to talk to you. Never. So one of the biggest things that I tell parents is you got to pick and choose when punishment is going to happen. Because if you do it every single time, especially with the big stuff, they're never going to come to you ever. You're shutting that down. With some of my clients, we have a card, we have a safety card that the child is allowed to come to their parent with this safety card. And this safety cards means I need you to stop and listen. And this is big, but this isn't punishment time. This is listen time. Like, not saying that you can't get punished over it, but you have to listen first. You need to hear what I'm saying. And this is usually like, I mean, this is the big stuff. Like I said, anything from like wrecking the car, but this is where when parents say, call me if you're out with a friend and they start drinking, call me to come pick you up. A lot of kids don't believe that because they're going to hear the screaming, the yelling, the how dare you, and that. And I tell parents, this is not the time. This isn't the time. So, even with sexuality, when they say, like, oh, I have a crush on this person or I like this person, ask questions. What does that mean?
Yeah.
Like, I have an 8-year-old and he told me, he said, I want to ask this girl to be my Valentine. And I said, well, what does that mean? He's like, it means I give her candy and she gives me candy. I'm like, okay, great. Sounds like you need a Valentine. Like, we can't shy away from these stories and these conversations. We just make it age appropriate. So for my 8-year-old, a Valentine's means I'm getting specific candy from this person and I'm giving this person specific candy. That was it. But we need to know, like, age appropriate. So when your 12-year-old says, I have a girlfriend, my question is, well, what makes her different from everybody else? What does that mean? What does that look like? We don't want to start out with you're too young, because what happens
Yeah.
is now that becomes a secret. It doesn't stop anything. It just becomes a secret. So if you start having these conversations, the younger they are, the more they feel safer coming to you when it's the big stuff.
Yeah. How does this relate to everyone else's experience?
Yeah, I mean, for me, um, I had a very understanding parents for the most part. However, I think just coming from a certain generation, the reaction may not have been the most conducive because I can admit certain reactions I got, it was like, no, you're not old enough, da 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 da. And like, see, me and my sister were totally different. So like my parents had to tailor their parenting styles. Right. And so I think that that's also something to consider and just really getting to know your child more. Because, like you said, you made a great point. Like, it's not that deep sometimes, In our minds, we're like, oh, no, no, this is too much. But really, it could just be as simple as we're just exchanging candy or we're just talking or I just say, you're my girlfriend and we may hold hands and that's as far as it goes. And it's not this big precursor to
Yeah.
going downhill,
I mean, your sister's gonna kill me, but like Jada is, they're so opposites, but like Brie is virgin. And so like there's very different experiences. She's gonna kill me for saying that. But it's true. And I mean, I can imagine how different it was given your two experiences with your parents, because like, you know, she just is an anomaly.
Right. Yes.
At our age. Um, and maybe not so much an anomaly. Do you know what I'm saying? I feel like, you know, depending on how you grew up and where you like, you know, what you believe is the best choice, then like maybe not. And I think you shouldn't feel like any age is too young or too old, you know what I mean, to be doing any of these, experiencing any of these things, you know? Yeah.
Absolutely. And that's part of the conversation that we need to have is that it's I mean, of course we would love for everyone to wait until it's a safe, healthy environment and all that good stuff. But let's be honest, it's not going to happen. What happens is we push things so back that it becomes unsafe, that we're not teaching them. You know, it's just like what they say about abortions. You didn't ban abortions, you banned safe abortions. So we're telling kids like don't have sex. Okay, now they're just not going to know what to do when they
Yeah.
have, you know, so whether we're saying protection and birth control and all this stuff, we also need to talk about the feelings that come with sex. Because to some people, sex is strictly physical.
Yeah.
That's fine. But to others, it's not. Especially, you know, depending on how you were raised, depending on what you were told love is, intimacy is, sex is. You're seeing it differently. So one of the biggest things that I like to teach, especially the teenager-ish girls, is that you need to ask your partner, what is this for you? Because I need to tell you what it is for me. For me, it's intimacy. I'm trying to get as close to you as possible. This is me showing my love. Now, if somebody responds or you know someone is like, well, this is physical, then maybe that's not a good match. Maybe that's not what you're looking for. And a lot of times we don't have those conversations, even as adults, even as grown, and I know my friends, 40 some years old, y'all not having these conversations. Y'all not saying the same thing. Because why are you so upset? You shouldn't be this upset if you had this conversation of what it was.
Yeah.
So we have to start saying, what is sex? When I say sex, what does that mean to me versus what does it mean to you? Are we
And
talking?
finding a matching partner that like
Yeah,
that makes sense, right?
absolutely. Because if I am just looking for a physical release, I'm not going to have that emotional attachment to you. But if you're looking for an emotional attachment with someone who just wants a physical release, this is where the drama, this is where the crashing out comes in. This is that. This is where everything breaks loose because we're not having the honest conversations. We're not talking about what this is for us.
Yeah, I think these are all very important points, and I sort of want to tie it back to like breast cancer and having breast cancer, especially for young women under the age of 40. Sexual health is very important. Like we said, there are some people who are still virgins in their 30s. But for those who are sexually active, I think it's really important to be comfortable with talking about this aspect of things, especially with all of the changes that your body will go through whenever you're undergoing treatment. If you've had your breast removed, there are a lot of physical changes. So after a mastectomy, typically the skin, including the nipple and the areola, are numb. Um, so what does that mean for you as far as like your sexual life? Whenever you're taking the medications like tamoxifen, that can cause you to go into premature menopause. That can also affect you with vaginal dryness. So whenever you see patients in those situations, how do you approach them as far as talking about their sexual health and different recommendations that you have for patients who are young but undergoing treatment?
Oh, so you said a lot right there, a lot. So one of the first things that I don't think a lot of people understand that has to happen is that they have to grieve, and they have to grieve the body that they had, the ideas that they had, everything that goes with that. You know, when we
Right.
talk about grief, we think of just the death of a person, but we have to grieve ideas. We have to grieve thoughts. We have to grieve visions. So, especially the younger women who thought that, oh, I'm going to breastfeed, I'm going to do this, I'm going to have that, that idea is gone. So the first thing I have them do is tell me what you thought this was going to be, what you thought everything was going to look like. And then we say, that's not an option anymore. We have to grieve it. And now we have to prepare for what is happening now. So if I have a woman that's like, I used to show off my breasts and all her pictures, the breasts are sitting up nice and perky and and then she has a double mastectomy and she's like, I've lost it all. And I'm like, nope, we just have to pivot. Let's look at your legs. Let's look at your butt. Let's look at your stomach. What else can you highlight? Like everything is not in one place. And especially for younger women, we are very concerned about how we look. Very. We're not going to be able to get around that. As much as I would love to say, oh, you're beautiful, you're fine. That's just like me saying don't have sex, knowing you're going to have sex. So I say, well, what else can we look at? What can we do now? So if it's the hair, I'm like, we're going to do a little Kim. I want you to go rock 4 or 5 different color wigs. I want you to embrace this because you can't get away from it. So let's enjoy this. If you are a breast person, now let's show up them legs. Let's see what that little behind is doing. Let's put some red in it. Like, what are we doing? So I have them grieve and then I have them have fun to remember what this can be about again, what this means. Because I say this all the time. The most confident woman in the room is usually not the prettiest or the sexiest, the one that holds her head the highest. It is all about your confidence, about your attitude. When you walk in a room and own it, everybody notices. Everybody. So it is, yes, I understand that physical part, but we got to get back to it. We got to get back to your confidence and what that looks like. So we're grieving. Then we get to the physical stuff. So are we talking about implants? What are we talking about? Like there is emotional support, which is all my confidence and all that stuff, but then it's practical support. What are we doing? Are we keeping, like I said, are we doing the implants? Are we getting nipple tattoos? What exactly are we doing? Let's have a game plan. Let's talk about this. What does this look like for you? What does this mean for you? How do you address it with your significant other? Or if you're dating, how do you explain to someone what you're going through? What does that look like? Right? So we role play the conversations. I'm like, okay, we're having drinks. What are we doing? What do you want to tell this person? Because you get to decide on how much they know. You get to decide on how much you want to tell them. So I'm like, get ready for it. Let's talk about it. What do you feel comfortable saying? And sometimes we'll go through a whole thing and then afterwards they're like, okay, that didn't work for me. I felt fake that entire time. I'm like, all right, cool. Let's try a different way. Because sometimes role play, you see what it doesn't work. Like that didn't work. That I can't see no man hearing me out like this. But they have to be comfortable enough saying, okay, hey, I do want to have sex with you, but the scars are there. I'm lopsided. I'm going through a mastectomy. I have whatever on me. We have to be comfortable saying it because the worst is the unknown. Like you don't want to shock somebody regardless. And then you have to deal with that. So I'm like, you want to put it out there. You want to be able to tell them as much as they need to know. If you feel like you need to keep your shirt on, you need to tell them the shirt stays on.
You're making me think too, that means so much for having had top surgery, right? Or any reason why you want to get your breast removed that comes up, right? And then I'm also thinking that like when you hear a sex therapist talking about role play, you're going to think it means so much more than role playing intimacy. That's what you're talking about. You
Yes.
can role play just the intimacy part of this equation, right? And I love that like we can kind of change the narrative of this because I think when I think about breast health too, I think about how the breasts have just been these things that have been sexualized, right? And so it's so good for young Black women to know that like these breasts serve a much larger purpose, and so how do you think that we can because that comfortability that comfort level with your breast will allow for more young Black women to be doing their breast exams, right? And not feel like it's this thing that's taboo, this thing that's like I can't be in tune with my breast. So how would you suggest that we like move forward in creating a culture around like not sexualizing breasts?
Well, I think the biggest one is we have to start at home. We have to start with the generations before us. Black women, we have an amazing tradition of oral tradition of how we pass things down, whether it's recipes, whether it's, how we make things in the house. We have to include health and sex in that. We have to. We talk about everything under the sun. We pass down traditions and disciplines and photos and wedding gowns. We have to put in health. There was a point in time where a lot of people didn't know what their family members passed from, whether it was HIV, AIDS, cancer.
That's still today.
Never, yeah,
Still happens.
Yeah.
We don't talk about it. We have no idea what people have passed from because we don't talk about that kind of stuff. We have to open the door and say, Grandma has cancer. Granddad has this. Auntie passed from this because we want to say, you need to pay attention. My paternal grandmother passed from breast cancer. She had it twice. She ended up having a double mastectomy. And the last time she was 85 years old, and she was just like, I'm not doing it anymore. I'm not going through chemo. I'm not going through anything. But we were aware of what was happening. So I started getting my breast exam at 30 because I was like, whoa, hold up. And I am one of those people. You guys can't see me now, but I love my girls. I put them on Front Street. Oh, yes, I do. So it was important to me, not just health, but a little vanity that I wanted to make sure that we were here and we were good. So me and my sister be like, you got yours done? Yeah, girl, they smushed me today. What you doing? Like how they do. We talk about it. We make sure that it's happening. So even with girls, I tell them if you have a circle of friends, last one to get their breast check has to pay for dinner. Drinks are on them. Make it something that we are okay about talking about. Oh, girl, something feel a little funny right there. Okay, well, did you check it out? And then you follow up. And we know how women are. We touch each other, we see each other. Speak up. Start having these conversations. Let each other know. But I think it starts at home when we're talking about our health history. When we talk about ancestors and we talk about family members, we have to include why they died. Diabetes, cancer, HIV, whatever it is, we have to be loud. Because if not, it seems like a secret. It seems like, okay, now if that happens to me, that means I can't say anything. Because I didn't know we had 3 aunties that died of cancer and nobody said anything. So if I say I have cancer, is everyone going to get away from me? Is everyone going to move back? That's the type of culture that we have produced. So we have to, cervical cancer, HPV, all of this stuff, we have to start saying, hey, have you gotten yours done? Do you have your vaccination? When is the last time you've had a physical? These are conversations we have to have. Have to.
Yeah, I think it's so cool too when I think about certain experiences that I had with my breasts or like family members' breasts that like made a difference, you know what I mean? This and like I remember like this is random. I'm like calling people out today. But my mother-in-law, so I grew up with my husband. I known them since I was 10 years old. So my mother-in-law, I've known since I was 10, you know what I mean? And I remember like her changing in front of me for the first time and me being like, oh my God, I'm seeing her boobs, you know? And I think that it's so comfortable for me to talk about health with her and my health with her. You know what I mean? Because it was like a thing that like women have boobs. This is like we all have boobs and we can change in front of each other. You know, we were at a store or something, but like it was or crying. We were trying like our Christmas outfits or something. You know what I mean? Our Christmas pajamas or something. And I just remember, but like because of that, I probably had no issue talking about my health with her ever. You know what I mean? Because she's a mom figure in my life, and that's just been normal, you know? And I also think about my sister who got a prophylactic mastectomy this last year about this time. And I'm over here always being like, you guys should see her new boobs. They're great. Like she wish she went bigger. You know what I mean? And it's like again, another moment where like clearly something I have talked to my family about boobs in a really positive way, and it has been a good experience. And I want to do more of that for other people, you know, as time goes.
And honestly, a lot of people are waiting for somebody else to just say something. They are waiting. I learned, especially with sex therapy, as soon as one person opens the door, everyone is running through it. They're like, oh, okay, this is what we're doing. Like, finally, somebody said something. So the moment we start talking about health and people talk about symptoms and what it looks like, people are like, wait a minute, hold up. I think I had that too. That sounds like me. Or maybe I need to go look into that. Or that's how you felt. We need one person to start the conversation. And if we start with our kids as young, letting them know you get a physical every year. You go to the dentist at least twice a year. If we start them with knowing that this is the stuff that they are supposed to do, that they should be checking for, it doesn't become awkward later on. They're used to it. They know, oh, this is what we do. This is what happens. So they get comfortable and they start talking to their friends and their partners. And we produce this culture and this family of people that regularly say, hey, it's that time of year. Did you check your breasts? that's what we want. So we have to make it as normal as possible. It can no longer be behind closed doors. We can't whisper. We have to start talking about why such and such is in the hospital. If I hear one more, oh, Shirley in the hospital for what? Oh, she's not feeling good. Don't tell me she's not feeling good. What is the real issue? What is happening?
Yeah.
Like, we're not talking. We're not. So, yeah.
Yeah, where else, Dr. Candace, where else do like sex and breast health, where else do we overlap here, you know?
Yeah, I think the other thing that I've been wanting to ask, but I don't want this to get too graphic, is there are different there are different types of orgasms. Like you can have an orgasm from like the nipple or the clitoris or the vagina or other areas of the body. So like what do you recommend for women who like no longer have sensation in the nipple and that's like a big driver for them sexually? Because I mean, I know we don't want to sexualize the breast, but um, it does provide some sensations during sex as well for some women. So, in those situations, what do you typically tell them, or how would you advise them to navigate that?
So actually, the very first thing I tell women, especially when they have a new body presented to them, they have to explore their new body. So their first homework is usually masturbation. I need you to learn what turns you on again, where the sensations are. Like you said, a lot of times you lose the sensation in your breasts or your nipples, or it's a new, a new structure. So before you have somebody else figure it out, you got to figure it out first. So the first homework is usually masturbation, and you have to, I tell them, explore your body all over again. Some people still have a little sensation. You ask yourself, is this sensation enough? Does this work for me? Or do you have to find a new sensational spot? What does that look like? We talk about the dryness that happens, and we talk about, do you want to go with a lubricant or a moisturizer? What does that look like for you? How are you going to decide which one you want to go with? And how do you present it? Because, and still we know, even through cancer and chemo, partners have egos. So part of them is like, oh, you're not getting this from me. You're not getting turned on from me. You need to use this. So how do we have that conversation? How do we say, hey, for now on, we have to use this. This is what's happening with me. So I need extra help. I need moisturizers. I need lubrication. So again, I think having those conversations beforehand instead of in the moment, where it could definitely turn a little sour. But before anybody else gets to know your body, you have to know it. You have to explore it all over again. And I'm probably dating myself right now, but there's an episode of Friends where Monica like points out, and she's like, the sex, what do you call them? Like pressure points, where she's like, oh, the neck, the thigh, the this, the that. And so she's literally like labeling, she's like, one, a two, a one, a two. And I'm like, that's what you need to do. You need to go and touch your body and be like, ooh, okay, one is go. Okay, one is the spot. One, okay. And then you hit the thigh for the three, like, ooh, wait a minute. I didn't could be sexy. Hold up. Let me make sure I'm writing this down. So they have to pay attention to their bodies again and say, this is a new body. It's not going to be the same. So you got to test it out. You got to see what's going on.
And I imagine that happens like at different points as you age in
Yeah,
general. It
yeah.
happens when you are entering motherhood or whatever. Like there's so many different times your body changes because like I'll just say like nipple stuff like didn't get me going forever ago and now it does. You know what I mean? Like now it's a thing.
Like you said, it definitely changes with age and with motherhood, because those positions change too. I can't do that anymore. Like pretzels were cute when I was 20, but not no, no, not now. No, my leg can't do that. No. So we're constantly exploring. And again, we have to have constant communication, because like you said, what I liked last year might not be the same as what I like this year. It might not have the same effect.
Yeah. Jada, what
That's
are
a
your
great.
thoughts here as a young woman?
Yes. My thoughts as a young woman, of course, communication. I feel like that is like the number one thing when it comes to sex. And I love how you mentioned also communicating, your emotional needs and your physical needs too, and how those things align. Because I feel like a lot of people, like you said, when they're raised a certain way or they're just on a different timing and their needs change and all of those things. And sometimes people go through trauma and whatnot. So it's like, again, goes back to communication. And I feel like it shouldn't be that hard to talk about, and also just understanding that when you do communicate about your needs and concerns and your boundaries, if it rubs someone the wrong way, then that should let you know everything about that person and how to not proceed with them. And so I think that a lot of it has to do with also respecting ourselves more, like taking initiative for our health, taking initiative for our pleasure. Like sometimes people don't know how to do that. And I think it just takes fortitude and takes maybe being fed up enough. Everyone has their thresholds, but at the end of the day, um, I think that's extremely important, communication.
Not feeling embarrassed about it, you
Right.
know?
Yeah.
Yeah.
No, 100%. Especially with like married partners or partners who've been together forever. I'm always like, if your car broke down, who would you call? They're like, my partner. I'm like, okay, if you ran out of money, who would you call? Your partner. I'm like, if you felt suicidal, who would you call? I'm like, my partner. I said, so when you're feeling horny, who do you call? And they're like, oh, I'm like, no, just like you called him, he was dying, he was broke, he was hungry. You called this person for everything except for this. Like, what are we missing here? And it's because a lot of times they're like, well, we've never had to say anything, we've just done it. And I'm like, in this day and age, it makes it so much easier because I love sexting. I think sexting is so great for people who are shy, who aren't ready to just say it in person. I'm like, you got a whole phone that you can just text whatever you want to, and then you can read the vibe back instead of like trying to present it as soon as you see them. I'm like, work your way up. It's okay, you can work your way up. But I'm like, if you can put this person's privates inside of you, you can have this conversation. Like you can do it. I promise. You
Also great for like a really big traveler or like a busy work life, Those are fun moments to add to your day.
Absolutely. And everyone, we talk about like love languages all the time, but people don't understand there's sex languages. So when I have couples come to me and they're like, well, we don't match when it comes to sex. Like everything else is great, but sexually, we're just not vibing. And I'm like, are you guys speaking the same sex language? And they're like, I didn't know there were sex languages. So there are 5 whole sex languages. But if you have someone whose sex language is fun, which means they are like the spontaneous person, the strip poker, play fighting turns into something sexual. And you have someone who is a patient person, who is like the slow burn, the massage, the candles. It's not that you physically don't match, y'all not speaking the same language to get there. So you got someone who's trying to get there fun and someone who's trying to get there patiently. And it feels like physically you don't connect, which you can and you probably do. You're just not speaking the same language to get there. So I have to make sure couples are speaking the same language first. So I'm like, you guys are speaking 2 different languages here. So we gotta talk.
That's important. I have another question about so again, for like patients or even just anyone as we age, like our libido changes, especially if you're going through treatment. What are some recommendations for you have for people who are going through that, especially if they're going through treatment, and they're like done with treatment to like try to get their libido back?
I tell everyone, go slow, take your time. Um, I know it sounds really childish, but I'm like, start with first base. Just start first base, go slow. You're not the same person. You're physically not the same person, mentally, emotionally, you're not the same person. So go slow. I'm like, I want you to text them. Oh, we about to make out like 16-year-olds tonight. Yes, make out like 16-year-olds tonight. Have some fun. I might let you go under my shirt tonight. Like, let me see what's going on. Take your time. Because, like you said, your libido is different. So I might only be ready for kissing. That might be enough for me. That might be as far as my body is allowing me to go. And we need to say this, but we need to practice it. We need to be okay with it. Because when we try to force stuff, it starts to feel like a chore. Now it's like, oh, okay, we haven't had sex in 2 weeks. Let me go ahead. No, we don't want that. We don't want that. Or, it's I'm too tired. I don't want to do that. That's great. Try another form of intimacy. you know, whether it's holding hands, a candlelight dinner, the massage, even just oral sex. Or sometimes it might just be like, hey, let's watch a movie, get some ideas first, and then maybe next time, this is where we can go at it. But I tell them, take your time. That is going to be the biggest. Because when your libido slows down, your body's not even reacting right. And what happens is it starts to hurt. You're uncomfortable, you don't like it, and you start moving forward. You have this very nasty taste in your mouth about sex. It's like, oh, that anxiety, that anticipation of it's going to hurt. I'm not going to like it, or, you know, whatever. So start slow. I always say, go back to first base. Go back to first base and see how you feel there, because then you can say, okay, we can go to second base. Wait a minute, I'm feeling good. Or you know what? You out at third. We done. Like, let them know. But I always say, take your time, work your way up to it so you can see how you feel. And if it's not feeling right, stop, pull back.
I
And
love,
piggybacking, oh,
no, go, Jada, go.
yeah, piggybacking off of Angel too, more from a physical standpoint, I heard about some different treatments that are available too for women with decreased libido, like something called an O shot, if you've ever heard of it, or like vaginal rejuvenation, where it's like, you know, they stick something inside you and it heats up and it helps increase lubrication too. So if it's like maybe you have that desire and you want to, but it's like physically, you have some inhibitions, those are maybe some options I've heard of too.
So, Dr. Thomas, I was going to say, you want to speak to the medical stuff?
Yeah, so I am a general surgeon. I'm not an OBGYN, but the O shot is typically given by OBGYNs. Um I believe it's typically Botox that's given, but I have to double check what exactly the medication is. But it is an injection within the vaginal wall that helps with increasing the sensation and arousal to that area. Um, and for vaginal rejuvenation, that's typically performed by urologists, or it can be performed by some gynecologists, and that's an extensive procedure that involves tightening the wall of the vagina. Um, and that's a little bit more extensive. There are some devices that can be inserted, but again, it's not my area of expertise, so I would defer to a urologist about that.
But it's good to know all the options that you can look into and that there are options, because you might just want to like explore those things, especially if you're like, again, like after treatment, after babies, after a lot of different things, or you're just changing. Um, I want to quickly say, because we do have the audience, our audience is young Black women. So I want to quickly talk about safety and what like we should know in terms of living a healthy and safe sex life for young Black women. So any thoughts there?
One quick thing, the O shot is actually, it's either plasma or platelets. It's not Botox. So, and that just helps to regenerate the cells that are in the lining of the wall of the vagina. I'm not sure how much research there is on that, but again, not my area of expertise.
Definitely get that. So, talking about safety, I think one of the biggest things with safety is um, we have to stop shaming people's sexuality and how they go about sex. Sex means something different from everyone. So if we're constantly shaming and putting people down and talking about how they enjoy sex or what they enjoy about sex, then this again, it pushes it to the background where they're not being safe, where they're sneaking around, where they're hiding, where they're looking for these fetishes and kinks in unsafe places. You know, I think one of the things R. Kelly did was he put on this big, like with the whole golden showers thing, but he created this huge shame the kink campaign that a lot of people. So if you hear your friends and your partner laughing about like, oh, they like golden showers, they like this, like that, and you are like, oh, wait, I like that. Like, you're not going to talk about your fetishes and your kinks because everyone is shaming this person. Everyone is talking about them and laughing about them. So I think one, we have to create this environment where we are talking about healthy sexuality, where it is okay that sex is physical for you and it's okay that sex is emotional for you. So that's one of the first things, is definitely talk about that. And then two, I always tell people, talk to your doctors, tell them what you're doing. Stop lying to your doctors. Stop lying to your doctor. I can't say that enough, because as a therapist, I think when people lie to me, I'm just like, you paying to lie to me? Like, this is
I
what
know
you
that for me, it's like if I'm paying for this, I really shouldn't lie.
but I think we have to stop lying to our doctors. We have to tell them what we're doing. Whether it's oral sex, anal sex, vaginal sex, we have to tell them what we're doing so we can be safe about it. You need to know the best kinds of protections that, we can use. Even when it comes to like condoms, and when people use lubricants, I'm always like, please use water-based if you're using condoms. Oil based lubricants break down condoms. And that's what we don't want. When we talk about dental dam, we talk about mouth. Oh, whoo. And I know, Dr. Thomas, you probably are very aware of this. Of course, I don't know if this drives you crazy as much as it does me. Oral health is huge with every type of health there is. So before you get chemo, before you do any type of major surgery, the first thing they do is send you to the dentist to make sure everything is closed up, you don't have open cavities and all this stuff, because oral goes to your entire body. And then when we're talking about sexual health, I'm like, if they have some type of infection or something going on in their mouth and they're putting it on your most private areas, it's going to spread. It is going to spread to you. So oral health is a big one. I'm like, please go to the dentist. Please go check this out. Bad breath, plaque, all of that stuff. Because I'm like, if you're not keeping healthy the stuff that we can see, what are you doing with the stuff that we can't see? So that one bothers me really bad. I think I was like traumatized. My grandmother is a dentist. My son's father is a dentist. So that, like, the oral hygiene has always traumatized me in ways. But yeah, so stop lying to your doctors. Tell them everything that you're doing so they can tell you the safest way to go about it. Because everything isn't for everyone. So we have to know what you're doing to tell you how to be safe about it.
On that note too, like go to your doctors
Yes.
regularly. You know what I mean? Like don't just go when that thing is wrong. Because I feel like often it's easy to go to the doctor when something is wrong with any private part, right? And so it's like you're inclined because something feels bad, you know? And it's like we can go to the doctor for all the things, you know? And then you're really not lying to your doctor because you're having honest conversations all the time, you know? That's so
Right.
important.
Yes. And especially with men, a lot of stuff is dormant in men. Like, they're not going to have the same symptoms. Like, I know men who'll be like, oh, I'm good, my wife good, so I'm good. No, that's not how that works. Like, your wife does not hold your health, but they won't go until something is wrong. And so promoting these physicals every year. And I know a lot of people are just getting out of them because they don't want like certain shots and stuff. That's fine, but you still need to have a physical. Please still go do the physical.
Yeah. Well, this is great. I feel like there's a lot has been said during this chat. But yeah, any like last thoughts, comments anyone wants to make about sex therapy, your relationship, your black breast health, anything of that sort?
I think I just want to mention also making sure that you're taking care of your mental and emotional health on top of that. And if you're spiritual or not, then absolutely taking care of that as well in terms of your sexual health, because it all coincides together. And I just think that, they all need to be, it just together, they're all important in terms of sex. So that's just my last remark.
Yeah, I'm hearing a lot of alignment and communication. That's
Yes.
definitely some big takeaways here.
And to piggyback off Jada, definitely communication, but also normalize it in the house. Talk about it. Like, we need to know what's going on with grandma. We need to know specifics. Everyone isn't dying from natural causes. Like, we need to have these conversations. When you normalize it in your house, your child grows up not knowing anything else. it's normal to them. I have an 8-year-old and he will tell you in a heartbeat, do you need some affirmations? Like he's like, what are your affirmations? Do you need to take a minute and breathe? Because it's so normal in my household to say stop and breathe, or what is your affirmation of today? When we normalize it, it becomes such just a natural thing that happens.
Yeah. And then just to piggyback off of what everyone's saying, just to make sure that when that we're talking about our mental health, because it's all tied to our physical health, there are studies demonstrating that there is a linkage between the two. Increased stress can lead to increased risks for diseases. So it's really important to not just talk to God, but to also talk to a mental health professional about these things, especially when you're going through a diagnosis like cancer, which no one ever plans for. So I always try to get my patients to talk to someone just as they're adjusting to their new normal.
And if sex helps your mental health, that's great.
And it does. Let me tell you, sex brings this euphoria. It takes away headaches, cramps. Let me tell you, orgasms are great for you. They are really, really great for you.
Yeah, no, I think this is a great conversation, something that we should have more often to, again, this conversation in itself normalizes this topic. And so we are very happy to have you, Dr. Angel. And yeah, so for those of you who don't know much about Love of My Girls, make sure you follow us at Love of My Girls. That's GURLS. And our new website, loveofmygirls.org, just launched last week. So check it out. You can find videos like this there as well. So thank you guys for this amazing Pink Table Talk, and we'll see you guys next month.
Thank you.
Yeah.
Bye.